I'd like to take a moment to introduce myself. I'm Suzanne Brown-McBride, and I'm the Deputy Director at the Council of State Governments Justice Center. And 3 years ago, when I had the privilege of joining the Board of Directors for the Justice Center while I was working at the California Coalition Against Sexual Assault, I was stunned and amazed by the work that the Justice Center did in attempting to find evidence-based strategies to improve the work that we do in the criminal justice system, whether that be through mental health work that happens in this grant program, the reentry work that we do through the Natural Reentry Resource Center, or the justice reinvestment work that our staff does every year in states trying to help make correctional funding more focused and more useful. It was then an honor on top of that to find out, though, that once I had the privilege of joining the staff of the Justice Center, that the work was even more incredible, that the staff was incredibly dedicated, and that the group of funders and consultants and contract folks that we work with and grantees that we had the opportunity to work with throughout the United States are some of the most stunning and talented people I have ever had the opportunity in 20 years of doing criminal justice work to work around and learn from. And this group of folks in this room right now are no different. I've had the opportunity to read through a good many of your grant proposals as we were getting ready to get our grant program going this year, and have been consistently impressed by the dedication and focus that you have on doing the right things for your communities, the right things for the constituents and consumers that you work with, and the right things to promote public safety and to make sure that we're using every very scarce public dollar in the most effective way possible. And so I congratulate you for not only getting out of your states, getting through the weather, getting here to beautiful Baltimore, but also I congratulate you for doing the work that you've done. This is very hard work. Oftentimes it's not congratulated or rewarded enough for what you do, and it makes an enormous difference in the lives of those that you serve. And so on behalf of myself and the Justice Center and the staff, we would like to thank you, and thank you for being here today at this event. I know that it is a good use of your time, and your time is very precious. It is also my honor to be able to introduce to you the Vice Chair of the Board of Directors for the Council of State Governments Justice Center, someone that has provided an enormous amount of guidance to us as we are thinking about how to try to create programming and outreach and materials that would be the most useful to you and to your work. And so it's my pleasure to introduce to you Pat Colloton, who's a state representative from Kansas. Pat represents the Leawood and Overland Park areas in suburban Kansas City and has practiced law in Kansas, Illinois, New York, Massachusetts, and Wisconsin, which is an amazing tour if you think about it. She has worked in the Civil Rights Division for the Justice Department in Washington, D.C., a Wall Street law firm, and on Wall Street, and in a law firm in Milwaukee. She's also received her undergraduate degree in chemistry and psychology and her law degree from University of Wisconsin. At Eli Lilly, she was a research organic chemist before law school, which is a truly, I think, humanities sort of approach to this kind of work. In the House of Representatives, she chairs both the Corrections and Juvenile Justice Committee and the Joint Committee on Corrections and Juvenile Justice Oversight, and serves on the Judiciary Committee. Representative Colloton is a member of the Kansas Sentencing Commission, the Kansas Reentry Policy Committee, and serves on the Council of State Governments National Task Force on Public Safety and Justice and their Legal Task Force. She's sponsored successful reentry legislation in Kansas and that has reduced the prison population and reduced recidivism for offenders selected for reentry programs. And like I said, has been an enormous source of guidance and insight for us at the Justice Center. So I hope you'll join me in welcoming Representative Colloton.
Well, welcome and thank you for being here. For the grantees, I want to say congratulations on your grant. You should be very proud. You are now the national leaders in improving responses to people with mental illness in the criminal justice system. Jurisdictions across the country are going to be looking to you for the work that you do and the models that you create. The federal government has chosen you because you have demonstrated that you are bringing people together across the criminal justice and the mental health systems, and that your plan and program is both data-driven and draws on evidence-based programs. The federal government is relying on you to keep doing what you've been doing, to take big ideas, broad general concepts that we all discuss, and translate them into everyday practice. It's the practical application that's the key to all of this, and to serve as an example to other communities trying to improve outcomes for people who intersect with the criminal justice and mental health systems. For the non-grantees who are here today, you made a very wise decision to come. I come from a county in suburban Kansas City that put in hundreds of hours of working on a grant on mental health and criminal justice that did not get accepted. We worked very hard working on the concept of a fact team to try to get a grant under the justice and mental health collaboration programs. But we were not accepted. But in not getting it and looking at the programs that had been accepted, we were able to refocus the next year our grant application to really understand what we wanted to do in our grant application, to be more explicit and more narrowly focused on what we hope to accomplish, how we wanted to go about it, and what our resources would be. We put together more collaboration than we had done in our first grant application. And as a result, we did receive a grant the next year. I think as a non-grantee, there's just so much to be learned here, and that conference will help you put that together. The Council of State Governments Justice Center is here to help you in every way possible. CSG has been a national leader in the criminal justice and mental health areas for about 10 years now. CSG, I want you to understand, is nonprofit, of course, nonpartisan organization that uses data-driven and consensus-based strategies to increase public safety. We try to use those things where it's really a bipartisan effort across the political spectrum that agrees that these are the good approaches to the particular practical applications. As Vice Chairman of the Board, we oversee the very active Justice Center. On our Board of Directors, we have 25 state and local officials that are Chief Justices of Supreme Courts in states, that are District Attorneys, Corrections Directors, Health and Human Service Secretaries in a couple of states, and other policymakers, like myself, a legislator. The board is politically and geographically diverse. For example, I'm a Kansas Republican, and our chairman is a Democrat from Queens, New York. He is the longtime chairman of corrections in the New York General Assembly. So we are very diverse, but we all understand, even though we represent a wide range politically, that there are too many people with mental illness in our prisons and in our jails in this country. We all understand that neither our police nor our courts should be the front lines for this country's mental health services. And that's where it is right now. You are the front line, and we've got to make the changes that switch that around. We launched the Criminal Justice Mental Health Consensus Project, a project that has resulted in this conference, about 10 years ago, as I mentioned. Congress, during that time, has shown its commitment to addressing this national problem. The Bureau of Justice Assistance is the leader within the federal government. The group that is sponsoring this conference is the leader within the federal government, bringing jurisdictions across the country together to develop innovative and cost-cutting strategies. Taken together, these strategies have increased public safety, saved taxpayer dollars, and most importantly, improved the health of some of our country's most vulnerable population. We're all here because we believe smart public policy really does work. I'm an example of that in Kansas. We had a demonstration project funded by BJA, and we had technical assistance from the Justice Center. This was before I was involved with the Justice Center. And as a result of that, we were able to develop a series of reentry policies, both at the executive level within the Department of Corrections, but most importantly at the community level within community corrections, that resulted in two things. We actually saw a drop in our prison population, and we saw a significant drop in crime. Over a 4-year period, the drop in new crimes committed by our parolees was 33%. Crime dropped a third for those who were in the reentry programming post-release and compared to what it had been in the past. So crime is down in Kansas by a significant amount, and we know these programs really do work. However, your problem is become even more difficult with all the fiscal restraints that we have. You also have to demonstrate what works. You know that they make the community safer and they improve people's lives and save taxpayer money, but the policymakers also don't want a political problem. And by that I mean you face relentless pressure from politicians like me, both to cut your budget, but at the same time don't bring us a headline that would be a front page tragedy. I don't want to see on a campaign postcard from my opponent in the next election a headline that is a disaster that occurred in the normal course of somebody re-entering into society. And of course, those instances will occur. These people are coming back into our communities anyway. The instance probably would have occurred anyway. But as you do re-entry programming, the politicians are all over you to make sure that they don't get any bad press out of it. So that puts you in a bind. You have to use the public resources very carefully. On the other hand, you don't want to create a political maelstrom, and this is very, very difficult to do, but we know that this is the right direction, and you've got the courage to bring it forward, and we, the politicians, will crow about the good success you have. But it does create more and more a need to collaborate with the politicians as well as between law enforcement and community resources. What's even more compelling, though, than general collaboration with your legislators is when the sheriff or a judge or a police chief come arm in arm to the legislature or to your city council or to your county commissioners. When you all combine in a collaborative way, we are absolutely impressed with it, and we really have no reason to go in a different direction. If you will collaborate with these different groups within the criminal justice mental health and come to the policymakers, I think you will find in most cases, even though we're a little political edgy, that we will acquiesce and go along with whatever you are saying as a collaborative group is the best approach to public safety and mental health. At some point, when your federal grant does run out, you will be coming to the county, city, or state level for funding. And having that collaboration together that you've worked through developing these projects will be a wonderful basis on coming to get the additional funding to sustain the program that the BJA has allowed you to initiate and develop. The fact that the federal government has singled you out in a special way to have federal resources to develop your program is also very, very impressive to your local city or county or state government. So you have a double effort here for sustainability, both the collaboration that you'll develop in doing your projects, but then also the fact that the federal government has singled you out to be the national leaders on these projects. I know in my county, we're strapped for money, but the county commission was able to match the federal grant for hundreds of thousands of dollars because they were both so proud that it was singled out in their second or third attempt for their collaboration project. And they felt that that really meant then that it was a very worthwhile project that county government, even though we're cutting everything, should get behind. So even in my county, again, I've seen this actually will work even with tight-fisted county commissioners. Finally, the fact that you're working with the Bureau of Justice Assistance is known, particularly at the state level. They are known here as the national leader in the mental health area and the development of these projects. And I think at the legislative level, that will be helpful as well. As a member of the board of the Justice Center, I can tell you that working with BJA has been just a tremendous benefit to what the Justice Center and our mission statement is, to promote these policies. Jim Burch and Ruby Kazelbash and Danica Zarvis and Rebecca Rose direct BJA's mental health work. They have helped us shepherd these grant programs from the very beginning. BJA also gets it that any strategy to improve outcomes with people with mental illness involved in the criminal justice system must be that joint venture between criminal justice and mental health. BJA itself has provided an example at the federal level of collaboration. You'll see throughout the agenda contributions from our federal partners. We have SAMHSA, the Substance Abuse and Mental Health Services Administration. We have the NIC, the National Institute of Corrections, and OJJDP, the Office of Juvenile Justice and Delinquent Prevention. Representatives from each of these agencies, brought together and brought forward by BJA, have been involved in planning this event and will be here to stand ready to assist you as you discuss the different features of the particular plans, strategies, and programs that you are developing here. I am very pleased with all this help and support from BJA, and I want to thank Jim so very much to introduce Jim Burch, who will welcome you to the event on behalf of BJA. Jim is the acting director of the Bureau of Justice Assistance, where he served for 15 years. He's worked in court and law enforcement. Jim understands and appreciates the perspective of people who work in the trenches on these issues. Jim, thank you so much for providing all of us with this opportunity. Welcome. Thank you.
Well, thank you so much, Representative Colloton. I appreciate the very kind words about BJA, and I take those words to really reflect on all the work that you all do, because our mission is to support you and to help you make a difference in the field. And without that, we don't succeed. So if we succeeded, you succeeded, and we certainly do appreciate that. Also, just want to remark how much we appreciate your leadership on all of these issues, not only justice and mental health, but also on our reentry work. We work so much together in a lot of different areas, the justice reinvestment effort. You've really been a great champion of this work, not only nationally, but also at the local level, and that's great to see, and I know others around the room are very envious of that. The Justice Center as well has been very, very supportive of all of the work that we've done in not only justice and mental health, but also, as I mentioned, the Second Chance Act programs, as well as the Justice Reinvestment Initiative, and a number of other places. And so I want to thank the Justice Center, Suzanne, Fred, Mike Thompson, and the entire Justice Center team for all of their work. And I also want to thank all of you for taking the time out of your schedules and fighting the bureaucratic hurdles that you no doubt had to fight to get here to be a part of this training event. This is a very, very key issue, as Representative Colloton has remarked, and as Suzanne has also remarked. This is something that's very important to all of us. You know, we see the cycle that's perpetuated at the state level, at the county level, at the city level, and nationally, with folks coming back into the justice system and back out and back in and back out, and that cycle of dysfunction, because our system is not equipped to address the needs of those people, really drains our systems. And I say systems plurally for a reason. It drains not only the justice system, but also the mental health system, right? So it's not effective for our systems or our organizations. Our agencies in the justice system in many ways are unprepared to deal with the needs of this particular client. Officers, law enforcement officers are presented with potential safety issues, as is the community, when our system isn't capable of responding, our organizations are not capable of responding to this population. And then clearly within the corrections environment, and I know that many of you here today are from the corrections world, if you will, we see increased burden on top of an already strained system in terms of staffing needs, in terms of treatment needs, and other resources. But just as importantly as those issues, and as you heard last night, I understand, from Ms. Kane, this is about people, and this is about saving lives, this is about restoring lives, as you heard firsthand last night. And so those are the reasons that we are here. And as I mentioned a few moments ago in response to Representative Colloton's kind words, this is really about you all and the work that you are doing around the country, making a difference, leading efforts, leading change, and showing people what can be done when you work together and when you focus on data-driven programming. Think about how far we have come with, for example, mental health courts, and where we started with that a few years ago and where we are today, now in the process of evaluating these strategies and replicating these strategies around the country. Look at CITs and CIT starting locally within a law enforcement agency in Memphis and then growing from there, now being replicated around the country in states like Georgia, now training not only law enforcement but also EMS statewide in the CIT type of approach so that we can replicate this strategy. And that wasn't done because of BJA. Our funding may have played a role in it somewhere. Our decisions to fund those programs may have played a role, but it was done because of you all and the work that you do at the local level. So our objectives at this event will really try to pick up on that, try to leverage that, and try to take that to the next level. And in particular, one of our objectives at this conference, or a theme, if you will, is to encourage you to tell the story. And when we say tell the story, what we mean by that is a couple of things. One, tell the story, put a face on it. Put a face on the work that you do. Again, you saw that last night, and you saw, I think, how powerful that message was when we put a face on the work that we do. But we're also talking about the face of you all, the workers, the systems that can change, the agency leaders that allow the change to occur. We have to put that face on this as well and show people around the country that there are leaders who have the courage to change the way organizations and systems work together to better serve this particular segment of our community. But we also, while we have to focus on the human impacts of this and the leadership impacts of this, we can't turn our back on the data. We must be able to demonstrate return on investment. And Representative Colloton remarked about this as well in terms of sustainability. We've got to have the data to demonstrate that our services are out there, they are effective, and they are meeting the needs, both locally and nationally. And when I say locally, I mean at the local level, city, county, but also at the state level and regionally. And by doing this, we will help sustain these efforts, not only at the national level or federal level, but also at the local level. When you go in to ask to continue these efforts, having that return on investment data and being able to put a face on the work that you do will make a tremendous difference. And I know there's at least one community that's represented in this room today that has experienced implementing strategies such as those that you're talking about here and then having them stop because of a lack of local funding, the lack of the ability to sustain it. And now they are back here again today to restore those same strategies that could not be sustained. So learn from those lessons. We have to learn from those lessons. We have to be thinking sustainability the entire time. And so much of the discussion, I think, that you'll hear over the next couple of days will be focused on performance measurement. And I encourage you not to do what all of us, I think, naturally do, is we tend to sort of run from that. We think of that as an administrative inconvenience. We think of that as a burden. Think of that as your friend, your ally, your point of leverage for sustainability. And so I encourage you to do that. And then I have to face up to our responsibilities within BJA. If we're going to ask you to collect the data and burden you to collect it and report it on a regular basis, then it is our responsibility to make use of that. It's our responsibility to pay attention to that data, to feed that data back to you, and to use that data nationally to advocate on behalf of your work. And so I hope that you will hold us accountable for that part of this bargain. Now, I was with Representative Colloton probably a year or two ago when then Senator Brownback came and spoke at a national reentry conference for our Second Chance Act programs, and he made some remarks there, now Governor Brownback made some remarks there that have really stuck with me, and I've repeated them over and over again. And he said, we have to start thinking about these kinds of efforts. And at the time he was talking about reentry, but he could have very easily been standing here before you all. He said, we've got to be thinking about these efforts almost like a business. And we have to constantly be looking at the data, looking at our, if you will, our sales, our inventory, right? We have to know what it is that we are doing every single day, and we have to use that information to make changes. You know, if you're in a business and you see that your sales are declining, you will start to make a change to reverse that trend. We have to do the same thing in this context. We've got to use that data, and so our responsibility is to find a way to give you that data back and to help you collect that data so that you can listen to those words from Governor Brownback and take that data and use it to make changes so that we don't have to wait until a grant is over or a project is ended to look back and say, wow, I wish we had done this differently. We would have had different outcomes had we provided X, Y, or done A, B, and C. And so I encourage you to do that. We're committed to this, and I think if you look at our funding solicitations, if you look at this last year, the one that you all competed in, or any of the ones that are going to be coming out this year, you'll see an emphasis on evidence-based programs that have been demonstrated to be effective in the research literature. You will also see an emphasis on data-driven programming. So collect the data to help you focus in on who it is that you need to bring those services to and how you are going to do it. The data is also important from the standpoint of understanding cost-benefit. I talked about return on investment. That's one piece of that. But there is a whole world out there around cost-benefit that we need to do a better job of bringing to you in that toolbox type of way. That is giving you the resources and the strategies to understand cost-benefit in your context. And so along those lines, we have funded and have increased our funding to the Vera Institute of Justice to implement something called the Knowledge Bank on cost-benefit. And I encourage you to take a look at that. They've got some podcasts, they've got some videos, and they've got some other resources that you can look at vera.org, V-E-R-A.org. And that's the Knowledge Bank on cost-benefit. Another goal for us during this meeting, as again Representative Colloton remarked, is to encourage collaboration. Encourage collaboration between you all, your state partners that are here, your local partners that are here, the mental health practitioners that are here, the justice practitioners that are here, and to encourage collaboration between us at the national level and you all locally. And as you heard, we are also trying to practice what we preach, if you will, within Washington and working together with some of the federal agencies that were mentioned earlier. And as Representative Colloton mentioned, those federal agencies were also very instrumental in helping us to plan this event. And so we need to continue to do that. In fact, the Attorney General recently convened, not because there was any particular mandate, but he convened the Reentry Council at the cabinet level within Washington. And so the Attorney General asked, for example, the Secretaries of Labor, Education, Health and Human Services, Housing and Urban Development, the Department of Veterans Affairs, the Department of Agriculture, the Department of Interior, including the Bureau of Indian Affairs and related agencies, as well as heads of the Office of National Drug Control Policy, the Social Security Administration, Equal Opportunity Commission, and the White House Domestic Policy Council, brought them together to Washington in his office at the request of the Attorney General to talk about some of the policy barriers that we at the federal level have unfortunately put in place to make reentry that serve the purpose of making reentry more difficult. And we've got to address some of those policy barriers. And so he brought those folks together. And I just have to share with you, I know some of you, I know there's law enforcement people in the room. I come from a law enforcement family, so I know automatically we're glass half empty type of people. So when we hear about things like this, we think, yeah, sure, those meetings take place in Washington every day. They come together, they have a nice discussion, and then they leave and nothing happens. This was a very different meeting. At this meeting, each of the different secretaries and directors went around and identified very specific barriers to reentry, and that pertains to this audience as well, to reentry that could be changed, could be addressed to improve reentry. And so some of those barriers are definitely now on the radar screen, and agencies are working very hard to change some of those. We've also been collaborating with the Department of Health and Human Services more broadly to help promote information sharing between justice and mental health, or justice and health practitioners. And so there is something called the National Information Exchange Model. For those of us that aren't technologists, the NEAM, or the National Information Exchange Model, is simply a data model that allows disparate information systems to more easily share information, to be interoperable. And so if you all think it's appropriate to share this information with your partners on the justice side or vice versa, if you use NEAM as a data model, which we are now all requiring as federal agencies, then we're one step ahead of the game. And so HHS has just signed on to be a key partner in the National Information Exchange Model. I know we have some folks here from the IGES Institute, which do a lot of our work in this area, and I encourage you to talk to them about NEAM. So we all need to be in support of collaboration. We also want at this meeting to make sure that you are aware of the tools and resources that are out there for you. And so the publications, for example, that are out on the table in the hallway here, or on the thumb drive that you were given, is one example of that. We know that there were some learning sites that were established for mental health courts, and we just recently established 6 new learning sites for the law enforcement side, CIT efforts. This is the peer-to-peer learning that we know is needed. And so it's important that you learn from each other, and that's what these conferences do. But when this conference is over, we want that learning to continue and that peer-to-peer network to thrive. And so in addition to those learning sites, we have also established an online communications discussion platform or portal for you to continue the dialogue with each other, and you'll hear more about that. I encourage you to stop at the table outside here or talk to any of the Justice Center staff or BJA staff about those resources. And then I think, this conference is also important in terms of getting everyone to think about where we need to go from here. And so getting funding or applying for funding and then coming to a training program like this, the last thing any of us want to happen is to go back, get caught up in the pressures of our day-to-day work, and forget about thinking where we're going to go next and how to get there. And so I talked earlier in the very beginning about all the reasons that we are here to address this issue. And we talked about how some of them relate to system cost, system inefficiency, ineffectiveness, but I also talked about the face of this thing. We have struggled for a long time to get attention on this issue. And I say we being collective we, not just the justice folks, but also the mental health folks here in the room and the health folks here in the room. We have struggled for a long time to get attention. We have got attention on this issue, not only because of the face of this, but because of the cost issues, because of the resource drains. There has never been a better time to focus on cost savings as a way to get this issue on the table than there is today. And so as someone said many, many years ago, and I was not alive then, carpe diem, seize the day. We've got to take advantage of this opportunity to get this issue on the table. And so this will result in smarter approaches to public safety and to health. So I encourage you to think strategically, to share the knowledge, collect and share the data with one another, and to tell the story, and to give us feedback on how we can help you do those things and how we can help you tell the story. One of the greatest resources we have is not our funding, but is our voice, is the things that we can do nationally through partners like the Justice Center and others. And so if there are things that you need us to do, tell us what it is, because we want to know how to help. We want to know what it is that you need us to do to be supportive of your work. And so I close with two things. One, enjoy the week, make connections with as many people as you can, and share information with them and share information when you get back. And last but not least, thank you again for taking the time out of your schedule to be here in Maryland with all of us. Thank you.